Hello, may I start now? Yeah, I can see
Yes, yes.
11, 12 students have joined. Yeah, I think probably we are meeting after a long time. I can't remember whether I have met you all. That means this latest batch. Uh, Whether I have taken any lecture of you, I can't remember at the moment. Probably I have not interacted with this batch. Anyway, this is 2019 batch. Uh, can your class representative CR, can he respond? Is it 2019 batch? Just let me know.
Yes, sir.
Yeah, and I just want to know the name of the topper, means the first position holder, because of course now the it is COVID times, but then one textbook on forensic medicine and toxicology has been given to me by some prominent author with the request to give this book to the first position holder of the previous this MBBS batch. So that's why I'm interested to know his name. So whenever the things normalize and you people join here, maybe the responsibility has been given to me that I should give it in person to that fellow. So may I know the name of that student who has topped the 2019 batch? Anyone can respond. I think everyone must be knowing who is the,
Shubhrajyoti.
huh?
Sh- Shubhrajyoti Mandal.
Shubhra Jyoti Mandal. Shubhra Jyoti Mandal. Okay. So I don't know whether he or she, whether he or she is here or not. Shubhra Jyoti, if you are here, then it will be better if I can just see you. So you can just switch on your camera and just I should be acquainted with you so that we can proceed further afterwards. Shubhra Jyoti, Shubhra Jyoti Mandal.
Good afternoon, sir.
Uh, can you switch on your this camera and mic so that I can just see you on the screen? Rest, of course, rest all are muted and their camera also is off, so there's no problem. You can. Okay, Shubhra Jyoti. When I think let's see when probably maybe in the month of July or August when probably we might resume the normal classes, physical classes. Then as soon as it starts, please come to me, right? And then I can give you
Okay,
that
sir.
book. Okay. Anyway, let's start this topic, very interesting topic of today, which has been assigned to me about the snakes poisoning, animal poisoning. Basically, when you talk about the animal poisoning, it's a snake's poisoning, which comes straight to our mind because that's the commonest creature and commonest poisoning what we see in our day-to-day sittings, day-to-day practice. So when we talk about the snake's poisoning, as an MBBS student, what you are supposed to know at your level, I will be just discussing few of those, discussing the basics. and trying to convey the snakes poisoning various aspects of that. Hmm, slide is moving. No. अरे कहाँ हो? अरे यार ये क्या है? हेलो. स्लाइड मूव नहीं कर रहा यार. हेलो. अरे तुम इधर आ यार, तुम एलटी में बैठा करो ना जब तक क्लास हो. तो स्लाइड मूव नहीं हो रही आगे. लेट मी सी वेयर. अरे स्लाइड आगे चली नहीं रही है. स्लाइड तो आगे मूव हो, तो चली नहीं रही. हाँ, अब चलिए. ठीक है. ओके. ओके. क्या किया तुमने? कि कुछ नहीं सर, आपने माउस दबाया नहीं. मैं तो क्लिक कर रहा हूँ बार बार. चलो एनीवे, थैंक यू. बोलो. ओके. So when we talk about snakes, there are two categories of snakes: poisonous as well as non-poisonous. And if you see the population of the snakes, poisonous versus non-poisonous snakes, in India, we have almost 80 to 85% species of the snakes are non-poisonous. But it's only the, you can say, the 15-20% of the total snake population that is a poisonous snake. And we know even the non-poisonous snakes can cause death. I'll come to that later. Well, it is the poisonous snakes which are, you can say, which comes into picture when we talk about snake poisoning. So there are two groups of the poisonous snakes. The major group, which the one we called as Colubridae, other one is Viperidae. The Colubridae, that means they are the category, they are oviparous, that means they lay directly the young ones. And the Viperidae, the viviparous, that means they lay eggs, and then afterwards from those eggs the snakes are born. The colubridae or the oviparous variety are further divided into two. The elapides, the land snakes, they are called as, they are grouped under the elapidae group. The other one is hydrophidae, that is the sea snakes. So sea snakes are covered under the hydrophidae group, and the land snakes are covered under the elapidae group. We talk about the examples of these land snakes, what we have must have heard, I think everybody of you: the cobra, king cobra, crate, and the banded crate. They are the land snakes which we commonly encounter when we talk about the poisonous snakes. The sea snakes are, of course, the hydrophidic group. The other group, that is the Viperidae group, they comprise of the Russell's viper, the saw-scaled viper, the pit vipers, the rattlesnakes, and the adders. They are the common species found in India. So that's one way of classifying the snakes, the poisonous snakes. The other way of classification of snakes could be on the basis of venom, what they produce, predominant effect, the venom they produce. So on that basis, we can say these the neurotoxic groups, that is the major group, neurotoxic groups, the venoms which produce neurotoxins predominantly. Here the cobra, king cobra, crate, and banded crates, they are clubbed under this. So that is the neurotoxic groups. The other group is the vasculotoxic group. The vasculotoxic group, all the vipers, they belong to the vasculotoxic group. That means their venom produce predominantly the vasculotoxic effects, right, or the hemotoxic effects. And then the sea snakes, they are predominantly musculotoxic or they affect the muscles. So on the basis of venom, they can be categorized into three: the neurotoxic, the vasculotoxic, as well as the musculotoxic. We just want to let's see the characteristics or how we can identify non-poisonous snake and snakes, because this is essential to know, because many of the times what we have seen, the relatives, if they catch hold of the snakes, they usually kill that snake, and they will bring the snake also along with the patient, and they give that history that this particular snake has bitten that patient. So just by examining that snake, you can know whether it's a non-poisonous or poisonous, because that is essential to know when we talk about the management. Because we have seen even the deaths have occurred due to non-poisonous effect, due to non-poisonous snake bite, because of the extreme fear, because of the massive anxiety which a patient, you can say, undergoes. Because we know that as soon as the name of snake comes to our mind, we have got some sort of fear in our mind as soon as the image of a snake is produced before us. So how we can differentiate? If you see, if you just turn upside down the snakes, if you see the belly of the snake, that means the ventral portion of the snake, then these belly, the all these reptiles, they are just covered with the various scales. So these belly scales, in case of non-poisonous snakes, usually they are incomplete. That means they will not cover the entire breadth of the belly, right? So that's one characteristic. Then the although the non-poisonous snakes will also have fangs, fangs mean the modified teeth, the elongated teeth, right? They are called as fangs. So they don't have the fangs. Instead of the fangs, they have got these several small teeth, and these are arranged in such a manner that you can see in this picture. They are arranged like this, uniform, several small teeth. So that is one characteristic. And of course, they don't have any hood like the thing at the, you can say, head portion, and no flat tail. Flat tail is the characteristic of the poisonous snakes usually. And no pits. Of course, the vipers, when we talk about vipers, they have got the variety of pitted viper and non-pitted viper. So of course here there are no pits. And the bite mark, even the non-poisonous snake which it bites, it produces a semicircular set of teeth, or you can say bite marks. So that way you can just know that it's a non-poisonous snakes. Coming on to the poisonous and the most dangerous, or you can say the immediate picture when we talk about snake is comes to our mind is the cobra. So how to identify a cobra? It has got a long and slender body, and the neck is not prominent, right? When you see the viper, then you can differentiate the head as well as neck of the viper when I will show you the photograph. Whereas in cobra, the it is in almost in continuation, and the neck is not prominent. It has got a long slender body, right? And it has got a hood with a spectacle or a monoceal mark, right? That you must have seen a kind of spectacle over the hood, over the dorsum aspect of the hood, right? And this is, you can see, this is a cobra. This is a hood where this the head portion is just, you can say, expanded in a all along the head portion. This is called as hood, right? And there are various varieties of cobra. And this is the monoceal mark or the spectacle mark. This is present over the dorsum of the hood. So that way we can identify that it's a cobra. And if you closely see it, the third supralabial scale, if you just see it here, the third, first, second, and third, this third supralabial scale, right? This just touches the eyes and nasal shield, right? So third supralabial scale just touches the eyes and nasal shield. That's also one of the identifying features of the cobra, right? Like this, uh, you can understand that this just touches the nasal fold. Then this triangular cuneate scale is between fourth and fifth infralabial, so that you can just if you grow further, you can just identify. And if you see the fangs, that means the modified teeth which are there, through which the poison, the venom is released. So the cobra snakes, they have got a short and grooved fangs, right? If you see the fang, that means the teeth, it is short and it has got a groove inside, right, on the inner aspect. That is short grooved fangs. They have, the cobra has got this kind of, if you do the transverse section of that, you can say fang, it will appear like this, right? So grooving is like this, you can just understand. And when it bites, it just you can say instills the venom through its fang marks, through its fangs into the body, right? So it just percolates down from the fangs, and then this poison or this venom is introduced. So it just percolates and trickles down that, right? The pupils are circular in case of cobra, and as I told you, they are they are they lay eggs, they and neurotoxic and all. The crate, the other commonest variety is a snake of the snake is crate, other than cobra. So common cobra, king cobra is there. The other variety is crate, and crate has got relatively large scales on the head, and there the fourth infralabial is the largest scale, like this. If you just see the head of the crate, so it will be like this, and the central row, and they have got the central row of hexagonal scales on the dorsum. So there is this, you can see the hexagonal shape of the scales like this, right? So you can see the dorsum, the hexagonal scales are there in the midline, and this is a you can say typical Indian banded crate what we see, right? And now the other variety, that is viper. The viper, if you see, they have got a short and stout head portion, right? And the as a result of that, the shape of the head is diamond shaped, right? And they have got a prominent neck. So as a result, this head becomes somewhat, you can say, just if you see the triangular in shape, and neck is just very much prominent. You can just see there's a differentiation between head and neck, and then it's very short and thick, stout body, and just you can say the tail is immediately tapered, right? Not gradual tapering. So that is again one point in favor of poisonous snakes, and this is how the viper snake look like. And there are small scales on the head, and if you examine the pupils, they are just slit like pupils. The vipers have got the slit like pupils, and their fangs are long and hollow, right, just like a needle. So they inject the venom, where the, as I told you, the cobra, they just they instill the venom, just trickles down the venom from through their fangs. Whereas in viper bite or viper snakes, because it has got a long fang and it has got a you can say needle like you can say shape, if you see the transverse section. So through this, the venom is inserted or injected into the body. So they basically inject the venom inside the body of the prey, right? So that's how the transfer section of the, and when they this release the venom, it's just like you can say a shower of that, because they just inject the venom. So it's not instilling, it's just injection of the venom the viper snakes do. And this gave birth to live young ones, right? Viviparous, not the oviparous. Oviparous is the which produce ovum, they are the cobra and crate, right? And then as I told you, the predominant effect of their venom is hemotoxic, whereas the cobra and crate, they are predominantly neurotoxic. The sea snakes, the third variety, and they have got a flat paddle like tail, so that it helps those snakes in swimming, and they have got a snout like head, and of course they are musculotoxic, as I told you. So if you see the sea snake, it just looks like that. uniform, so that it just helps in the swimming process, right? Like this. Then what is snake venom? Snake venom is a clear yellowish colored, somewhat yellowish, what we specifically called as amber color. This, and it's a water soluble. Basically, it is an enzyme, and it contains so many further enzymes, proteolytic enzymes, phosphatidases, neurotoxins, erepsins, cholinesterase, hyaluronidase, ribonuclease, ophioxidase, but predominantly neurotoxins, right? Because the venom is basically, you can say, enzyme comprising of all these things, and because it helps the snakes to kill the prey, right? So different enzymes have got different action over the prey, and so that first they have to just you can say catch hold of him, and then when as soon as it is injected, so just to overpower, so their muscular junctions are paralyzed, right? Like that. Then afterwards, uh, further process of digestion, right? So predominant effect of those venom is neurotoxic, so that the its prey becomes paralyzed. Then if you see the constituents of venom, it has got more than 20 different constituents, mainly proteins, all those, because so that it helps in digestion, the in digesting their prey or their victim, right? This now let's understand the intricacies of the this venom injection process and the toxicity produced by the different snakes, where all these factors come into picture. Because you can understand now, the quantity injected per bite by different snakes is very variable, right? And it depends upon so many factors, like the snake coming out of hibernation. We know there is a process of hibernation and estivation when they go into prolonged stage of, you can say, hibernation inside the earth, and then they lie for several months, and afterwards when they come out, and then they shed and they do molting and all, and then they come out from the hibernation. In that stage, of course, you can understand the concentration of the venom will be very high, because they have not released the venom since many months, right? So snakes coming out of hibernation, species and size of the snake. Species, as I told you, different species have got different constituents of venom, so depending upon that, the venom is, you can say, it varies. uh, the size of the snake, of course, the small, the younger snake will have a lesser quantity of, you can say, venom, but it doesn't affect the, you can say, venomosity. Toxicity remains the same even by the small snakes, but only that the quantity of the venom produced by the smaller snake will of course be less. And then of course the mechanical efficiency of the bite, how much, you can say, properly the bite is being made, right? Whether it is a directly inserted or sideways, right? Or so many factors, right? If it is inserted like this and it goes all the, you can say, all the way inside the body, then of course the effect of the venom will be predominant. If suppose out of two bites, out of two fangs, only one fang is able to bite, then it will be less. Or suppose sideways bite is there, then again it will be less. So all these comes under the mechanical efficiency of the bite. So how the bite has occurred, these factors will be changed, right? All these repeated strikes. Then several snakes, they have got this tendency to bite repeatedly. Some snakes have got tendency to bite just once or twice, but then they, like cobra or king cobra, they have got this, you can say, the quality of repeated strikes. So they go on, you can say, striking, and then in the process releasing the venom, right? So yeah. And then, as I told you, bites by the even the smaller snake should not be ignored or dismissed. As I told you, the toxicity of the venom remains the same, right? Now coming on to the fatal dose of the venom, snake venom produced by different snakes. If you see the roughly the venom produced by the crate has got a fatal dose, very less fatal dose. That means that is 6 milligram, right? Approximately. Then the Cobra has got approximately 12 milligram, right? And the Viper venom, the fatal dose is approximately 15 milligram, right? So that means the crate venom has got the least fatal dose. That means even the very small quantity of 6 milligram, the crate venom will be fatal. Whereas Cobra, you need 12 milligram. The Viper, you need 15 milligram. That's a general statement, right? There are, of course, different varieties and venomous and all. That's a different issue. But then, if you see, the common belief is that the cobra is, if you ask anyone which is the deadliest snake, what they assume or they feel, immediately almost everyone will answer that this is the cobra venom, which is supposed to be the deadliest because we have seen so many deaths due to cobra bite, not due to the other snake bite. Of course, there are so many factors for that, but the most important factor that I am talking or I want to convey here when I want to discuss about the fatal dose, the quantity of the venom released per bite, right? That means if I say that crate venom roughly releases 2 or 3 times of the fatal dose. That means say around 15 to 20 mg milligram of the venom is released by a single bite of a crate snake. Whereas the cobra releases almost 10 to 15 times or maybe 15 to 20 times of the fatal dose. That means roughly a cobra venom releases 150 to 200 milligram of venom, right? And almost you can say these 5 times roughly for the viper venom. So now if you see the total quantity of venom injected per bite is much more in cobra than the other, right? Because it is releasing 10 to 15 times of the fatal dose. So even in that situation, even if it's a single bite, even if it is the side bite, or even if it is bitten over the cloths, all these factors, but the quantity of venom injected will even be more in that scenario. And that's why the cobra venom is supposed, or you can say the cobra is supposed to be deadliest because of this factor. But if we talk about the pure, in terms of fatal dose of pure venom, it is the crate venom which has got the least fatal dose. That means it is the most fatal, 6 milligram only, right? And then the fatal period, the colubrine group, that means the cobra and crate, they have got the fatal period of approximately 20 minutes to say up to 6 hours, again depending upon many factors, right? Usually the fatality occurs within this much period, right? Neurotoxic effect, predominant neurotoxic effect and all those. Whereas the viper bite, the fatal period is you can say goes up to 2 to 4 days because they are predominantly hemotoxic or vasculotoxic. So they basically affect the clotting system, the clotting mechanism of the body, and there when the blood is blood and they affect over the blood, hemotoxic as I told you, then that takes time, right? And that's why the fatal period in case of viper bite is much more, right? If you see the features of snake bite, what we called as ophitoxemia, right? So it just like this bite is just looking like this small needle type of, you can say the pinpoint, and then showing the hemorrhages in that area, right? That's one thing. And yes, when we talk about the bite mechanism and bite, let's understand the other thing, associated things with that. There are phenomena of dry bites because this not all bites produce envenomation. That means many of the times the snakes does not release the actual venom, right? It just produces the hissing sound just, right? But it does not release actually the venom. Why? Because for the snakes, venom is very precious. It, you can say, it wants to use the venom to kill its prey. not against the human beings. Human being just an accidental phenomena. So it is just a defense mechanism for the snakes, in fact. So because of that defense mechanism, many of the times it just produces the hissing sound and it doesn't actually release the venom, right? So that's why there are so many dry bite cases. And on a rough estimates, the 50% of the Russell Viper bites are dry bite. 30% of the Cobra bites are dry bites. 10%, 5 to 10% of size-scaled vipers are the dry bites, right? So that those factors also we have to keep in mind, right? Because this all will affect the features of the clinical features, or we called as ophiotoxemia. So if you see the local sign symptom, there will be production of fang marks, local pain and bleeding. The patient will complain of bleeding. You can see also the bruising will be all around the bitten area, and then simultaneously there will be lymph node enlargement because this venom goes through lymphatic drainage system. Meningitis will be there, the inflammation, the blistering will be there, and later on, because of the local infection, the abscess formation may be there, and ultimately necrosis may also be there, right? So it may bite on different parts of the human body, and then appearance of the bite mark will differ from place to place, like it is just you can say the old so maybe 2 3 days beyond. So beyond that, if you see, it is like that necrosis is occurring, and now there's in the last one you can see the necrosis is there, all those, right? And because of that predominant neurotoxic effect, the person is unable to open his eyes, right? Because it paralyzes those muscles. And if you see like that, the edema is also there. And then there's a predominant bilateral conjunctival edema. This is there by or Russell's viper bite, typical of that, or for that matter, any vasculotoxic, because that will produce this kind of eyes, right? So this bilateral conjunctival edema, as soon as you examine, so you can just see whether it's a neurotoxic bite, upper one, right? And where it's a vasculotoxic bite. And then gum bleeding. Bleeding is a hallmark of the viper bite. So if the bleeding is occurring from the different parts of the body, from different orifices, it indicates the vasculotoxic, predominant vasculotoxic, or the viper bite, right? Now, how to treat, or the case of snake bite uh, in India. So, because in India there are so many cases of snake bite deaths due to snake bite, and a rough estimates almost around 50,000 deaths all over India. I'm talking about 50,000 deaths still are occurring due to you can say snake bite, because of so many factors. If you go onto the rural side, the villages side, still they will first, they will you can say go to all those local persons, the oja hakim and all those, instead of going to the hospital thinking that the jhad phuk se and all those, the person will get cured, because of that belief, all right? So that is also one of the reasons, delay in the transportation to the hospital. So many of the times that is the reason for that, for the you can say death due to snake bite. So in India, what we recommend is do it right. If you just see the word right, I have written is RIGHT, right? RIGST. If you just remember, do it right, it will be very easy to understand. R, this the right, the R of the right stands for reassuring the patient. Reassurance. That is the first and foremost of hallmark of the treatment of the snake bite poisoning, right? Reassurance. It's the most important part when we talk about the snake bite management. That's the most important part, right? Because as I told you, the 70% of all snake bites are from, or even more, maybe 70 to 80% of the snake bites are due to non-venomous species. But still patient dies because of the massive fear, extreme anxiety. So that needs to be taken care of. That needs to be consoled. That needs to be assured. Now, how you reassure the patient, that is also an art. It's not that easy, right? Now, after understanding all these basics of the snakes and all, so now how to proceed further? How will you reassure? Okay, the first, you will tell the patient that, okay, listen, don't worry, I am here as a doctor, you are in safe hands, right? And then you can explain further. Look, almost three-fourth species of the India are non-poisonous, non-venomous, right? So even if the snake has bitten you, the chances are there that it is a non-venomous snake which has bitten you, because it is the three-fourth of the snake population, and chances what we see in the vicinity is most of the times it is the non-venomous species. So that's first and foremost. Then, even if it is a venomous species, or even if it is a venomous snake, right? It is not necessary that it will inject every time a venom, because now you can explain there are cases of dry bite. So many snakes, it's just a defense mechanism. So actually they don't inject the venom. So cases of dry bite, so nothing is going to happen to you. Just relax. Another. Then you will explain further that, okay, even if it's a venomous snake or the poisonous snake, then there are chances that it may not have, you can say, inserted the full venom, complete venom, because of these factors, right? So that way the patient develops, you can say, confidence in you. And most of the times, if it is a non-poisonous snake, the things will be sorted out there itself, right? Otherwise, the many of the times the non-poisonous snake bite also, the patient dies because of that extreme fear. Then next, for right, the next alphabet is I. I stands for immobilized, just like as a fractured limb. So wherever the snake has bitten, so that part of or that limb should be, you can say, immobilized, right? So use bandages or cloths to just hold the splints, right? So that whatever the venom, it should not be, you can say, through circulation, it should be minimized. It should not go inside the body, right? And then your idea is to not to block the blood supply. As I told you, it spreads through the lymphatic, right? So don't do it tightly and all, so that otherwise the blood supply will be hampered, and then the limb may develop the gangrene, right? So that's why don't apply the tight ligatures as well, right? Because they can be dangerous. So the patient will have problem because of your you can say poor immobilization process, right? So that you have to keep in mind. Then the third and fourth word are GH. GH means get to hospital immediately. That's the message which, through many forums, through public awareness programs, what we advocate and we try to disseminate to all those. GH, get to hospital or go to hospital immediately, right? Because all those traditional remedies, is ojhas, jhad phuk, all those, right? These are not going to help you. They have no proven benefit in treating snake bite, right? Why it was happening like that? Because you know that in 75% non-poisonous snake bite, person will all become all right, right? So jhad phuk, oja, it was just you can say doing all those things, and then other factors, right? It's basically the time buying, right? So if the 5-6 hours is enough for a neurotoxic effect to be there. If it is not there, it will not be there. So patient becomes all right, right? Likewise, the other one, the viper, depending upon all those factors. Now you know very well how much the venom is injected, and what are the various factors which snake has bitten, and all those things, because the public does not know which snake has bitten, right? So all these things you just need to disseminate, or you can say just take the patient into confidence. Then T, the T stands for the last word of the right. T stands for tell the doctors. That means any systemic symptoms such as ptosis, as I told you, ptosis, that means the drooping of the upper eyelid, that happens predominantly in the neurotoxic snake bite like cobra and crate, right? So if that is there, they are a dangerous sign because that shows that neurotoxic effect is, you can say, has started occurring, and that may go into an irreversible process, right? So all these things, this how to do the immobilization, a proper immobilization of the limb, to tie the limb, whether the upper limb or the lower limb, that you have to learn, of course, during your clinical posting. If suppose some snake bite case comes to you, then you will be in a in a better position to understand, because once you do it yourself or you see it yourself, it gives a, you can say, much better idea. Of course, here we are just covering the, you can say, on the lecture basis, theoretical basis. So when the patient or the person is to be shifted to the nearest hospital, then uh, you can just keep the patient like this, so that he is straight, and the circulation and all, your idea is to just minimize. Otherwise, if the patient is in lying down position, the circulation will be faster, right? It will, the spread will be faster. So keep the patient like this, right? And as soon as the patient can be transported to these hospitals, this is must be done. And there are this last time we have revised this management of snake bite, especially for Indian conditions. This was done by the ministry in January 2016. We revised all those standard treatment guidelines for the Indian population. um, I was also part of the subcommittee which we drafted all these guidelines. So, as I told you, when we talk about the treatment, the reassurance is first and foremost. Applying of the tourniquet so as to just block the, this is the tourniquet or any, you can say, the material which can just block the lymphatic circulation, not the, you can say, arterial or the venous circulation, right? Sometimes